All right, so our next demo is from J. Todd Fethering, and he is the founder and chairman of Stratasan, and he will be presenting the Stratasan magic. Thank you. Welcome.
Stratasan. Strata meaning layers, san meaning health, layers of health. In our demo today, what we want to do is to show you the faces of healthcare. We're going to do this through our more than 1 billion health records that we've been able to amass, but we're going to do it through these three families: the Johnsons, the Davises, and the Chews. So let's drill down into the Chews, into their neighborhood. And what we see immediately with our tool set, this is an example of patient de-identified information that you might receive from a ACO, hospital, health plan. But we see that this particular patient's been to our facility at least 3 times. It could be one patient who's had a chronic disease back 3 times, or multiple people from the household. The next thing we'll do is zoom out just a little bit. And we're using some of ESRI's tools here today. And we see the Davises and the Johnsons as well. Since we're working at a neighborhood level in this particular situation, we're also able to connect these individuals to demographic profiles, psychographic profiles, and a variety of other databases that you'll be able to see. The next thing I might want to do is layer over where all of the patients are in this particular market, and then I can begin to do some magic with these patients. The first thing that we always do is to look at service area. And you might think this sounds a little boring and mundane, but I can tell you it gets people very excited in the boardroom because this allows you for the first time to define your service areas with address coding instead of geographical boundaries. And that's really large in healthcare because we have multiple data sets, some available at the zip code level, some available at the county level. So we take the latitude and longitude of the patient's address, the latitude and longitude in this case of a facility, and we're able to see where 50% of the patients are located in the dark red, 75% in the rose colored, and 90% in the beige. Traditionally in healthcare, and we've seen several demos this week similar to this, we look at the world through zip code lens. Zip codes are great for getting the mail to you. They have absolutely nothing to do with how patients and or consumers interact with healthcare. So as you can see very quickly, a exact same data set looking 2 different ways at it. The Stratasan way tightens it, focuses, presents a more clear picture of those patients. The next thing that I wanted to show you very quickly is then how we would go about overlaying additional demographic data. As you can tell, I have many, many layers of which to choose from. So I'm going to turn on household income, and I'm also going to overlay information communication technology workers so that I can understand what the business psychographic profile looks like, as well as demographics from the local area overlaid with our 3 families and our patients all on one map. So it gives the user tremendous amount of visual control over strategy and also to understand how the market is moving around. The next thing I want to do is flip over into the Stratasan cloud, and we're going to do a little further explanation of these patients. So Mr. Chew had heart failure and shock, DRG 291, recently. So in this particular market, I can now drill down into 291, and I understand that there are 50 total cases in a period of a year that we can see. We derive this data through estimates and projections that we do with the National Hospital Discharge Survey. We also do on the physician, outpatient, and ED with the National Hospital Ambulatory Medical Care Surveys. Next thing I might want to take a look at is by product line. So I want to understand how many of these patients that are coming to my facility versus how many are going to another facility, and I can do this by service line analysis with cardiology. And so here I see that I'm leaking out probably 120, 130 patients out of this market. that probably translates into about $6 to $10 million in revenue for a typical hospital provider, not counting physician services, pharmacy, lab, other expenditures as well. So you might say, well, that's very interesting. How would I go about then understanding all the charge and cost information that might be related? So I've run a DRG cost report for you guys out of our system. And here we can tell for all of the hospitals in the United States how many cases were done in Medicare from the MedPAR files for DRG 291. Okay, so we see that Florida Hospital is number one by a long stretch, and we can also see how reimbursement, charges, and cost are really differentiated by facility. The next thing I can show you would be a little drill down into that same data, and in this case, we are looking at the exact same data, but when we export it out, we're able to give you some additional departmental level data on operating room charges, total cost, anesthesia charges, pharmacy, and additional data that before we haven't been able to tie both the financial, the quality, the clinical aspects with the patient origin information. So now today we can do that and have a much clearer picture of what is going on in healthcare today. So in conclusion, we started off with our 3 families to help us understand out of billions and billions of records, what do these families need? So now we're able to have a much clearer picture of what the CHUs look like from a cardiology perspective. We also know that they're in a neighborhood with connoisseurs from the Esri Tapestry system, Suburban Splendor and orthopedics, and ER and N-Style for the Johnsons. So that's Stratasan. Thank you very much.
Well, thank you. Well, so that concludes the apps for care. Let's give a hand up for all those demos. Those were really awesome.